Hello, I'm Dr. Marla Shapiro, and I have the pleasure of sitting on the Board of Trustees of the International Menopause Society. And today I'm joined by Dr. Antonio Cano. Welcome. Can you please tell our listeners and our viewers who you are?
Thank you, Marla. I am a professor of obstetrics and gynecology at the University of Valencia in Spain. And I have been the president of the European Menopause and Andropause Society for 2 years. And now I am the co-chair of the Council of Affiliated Menopause Societies at the IMS, International Menopause Society.
So welcome. Today we're talking about something that is well known to practicing practitioners, but perhaps not so much the women who are listening to us. And what we're talking about is something called the metabolic syndrome. So firstly, describe what do we mean when we talk about those symptoms that comprise the metabolic syndrome?
Well, it is a cluster of risk factors which group together quite often. And the definition changes a little bit depending on the source. For example, the WHO differs from the International Atherosclerotic Society, but there are very small differences. Basically, it is a cluster of 4 different risk factors, which is dysglycemia, including the possibility of diabetes, then increase waist circumference, increase blood pressure, hypertension, and hyperlipidemia, consisting of high levels of triglycerides and a reduced concentration of HDL, which is the lipoprotein, taking cholesterol from the vessel wall.
Okay. So how frequent is it?
Well, it's quite frequent actually because there is an increase in the rates of obesity. We have just commented that the increase in waist circumference is one of the risk factors, and there is an epidemics of obesity at a global level. And also there are data, for example, from the OECD, which consider that in some countries, it might be like 40–50% of people
Wow,
obese.
amazing. Is there an association between metabolic syndrome and menopause?
Yes, this is something interesting because women during the period of menopausal transition, they suffer not only hormonal changes, but also metabolic changes. There
Mhm.
is a change in the body structure. So there is an increase in the waist circumference, which we have just mentioned is one of the components of the metabolic syndrome. And also there is an increase in fat. So there
Mhm.
is not only in the absolute amount of fat, but also in the percentage of fat, because this is coexistent with a reduction in the muscle mass, an increase in sarcopenia. So finally, it all ends up in that women increase the waist circumference, increase the visceral fat, which is a main determinant of metabolic disturbances, and also an increase in the amount of fat they have.
So
So
when we think about going to your healthcare practitioner, we think about getting your vitals done. You get your heart rate done, your blood pressure done. We may do your weight and your height. But what about the notion of actually measuring the waist circumference? Does that have a role in seeing your healthcare practitioner? Is that something that should be measured on a woman?
should be should be because something very easy to do when a particular patient comes to the office, and also because the implications of an increase in that circumference are quite high. There are, for example, interesting data from the WHI, which is the Women's Health Initiative study. There was an observational study including more than 100,000 women, and it was shown that those with an increase in waist circumference, whichever the weight they had, even if they were or were not obese, there was
Mhm.
an increase in risk of cardiovascular disease. So this is something easy to do and with great implications in terms of health.
Yeah, and that's a very important to make a note for women that even if your weight is within the range, but if you carry all the weight in the middle, it does have implications. So having that and the metabolic syndrome, what does it translate in terms of those types of cardiovascular risks? Are these women at increased risk for heart attacks?
They are, yes. It has been calculated grossly because that changes from country to country and from even with ethnic, depending on the ethnic background. But it has been calculated that there is a double risk of cardiovascular events in the next 5-10 years if you are diagnosed with, you have the metabolic syndrome.
Hmm.
So it's quite important.
So, women who are suffering with menopausal symptoms and have meet the criteria for metabolic syndrome, as you've described it, what is the role of menopausal hormone therapy? We know that it's there for the indication of hot flashes and night sweats, but will it have a positive impact on the risk associated with metabolic syndrome?
That's very interesting, yes, because these women, obviously, if they are symptomatic, they need the menopausal hormone therapy. But the good message is that hormones seem to control, not totally, but reduce the burden of metabolic syndrome. There are nice data. Well, there is very much experience in experimental studies showing that hormones, estradiol, estrogens, control the accumulation of fat, but also in women, some clinical studies showing that whenever there is a decrease in estrogens in blood, there is an increase in the accumulation of fat. And this is something which has been shown, as I say, in clinical trials, small clinical trials in which women were measured very finely with, for example, densitometry, which is a technique that is able to measure the amount of fat you have in the different regions in the body. And also in bigger studies, for example, the PEPI trial, in which it was shown that women who were treated with hormones had also increased the amount of fat, but less than those that were receiving placebo. So finally, it's good news because you not only control your symptoms, but also you add a piece of control to the metabolic derangements that you suffer during that period.
So clearly, the message we want to give women is to control these risk factors to prevent the development of metabolic syndrome. But if metabolic syndrome is already present, how does that play out in terms of what women can do to limit the risks of outcomes that you just outlined?
Well, that's the good moment for a healthy lifestyle. You have the option, for example, of exercise, which is easy to perform and which decreases the risk of most of the components of the metabolic syndrome, lipids, hypertension, obviously also the control of glycemia, of sugar in blood. So it is important to run, to jog, to do something that will certainly help to reduce the burden of the metabolic syndrome.
And before I let you go, I can't let you go with talking about the role of nutrition for these women in terms of, often what you eat is often what you become. So what is the benefit and what is the role of nutrition and what should women really be focusing on in terms of looking at what they eat?
That's also the other component of lifestyle together with exercise, with physical activity. Nutrition, healthy nutrition, and is something which does not need to be very complicated. Just, for example, Mediterranean diet is something
Yes.
flexible, something that you only know that you have to eat more nuts, more intake more olive oil or fruits, for example, and just by increasing those components, you decrease the risk. There are many studies about that, and it has been shown that there is a reduction of 20% of metabolic syndrome just by following those general rules. So it is easy and important.
Well, thank you so much for joining us. For our women who are listening to us, remember that it's not just weight, it's where the weight is, particularly when it comes to metabolic syndrome, and all the great advice about lifestyle and nutrition, and the fact that it's never too late to make a difference. Thank you so much for joining us today.
Thank you.